Hello, and thank you for joining us. Today we are discussing Building Consensus for Electronic Health Records. This presentation was created by Charity Wilson, Lori Robbins, Sarah Welch, and Jeanette Vernon. An electronic health record can be defined as an electronic record of health-related information for an individual that conforms to nationally recognized interoperability standards and that can be created, managed, and consulted by authorized clinicians and staff across more than one organization. Electronic medical record is a legal record created in the hospital or ambulatory environment for each patient visit that is the source of the data for the EHR. Meaningful use is using certified EHR technology in order to improve quality, safety, efficiency, and reduce health disparities, engage patients and their families, improve care coordination, population and public health, and maintain privacy and security of patient health information. Integrating meaningful use technology and using the electronic health record results in better clinical outcomes, improved population health, increased transparency and efficiency, empowered individuals, and robust research data on the healthcare system. Meaningful use sets specific objectives that eligible professionals and hospitals must achieve to qualify for CMS incentive programs. There are many benefits to the electronic health record. The general benefits are improved data integrity, increased productivity, improved quality of care for the patients, and increased caregiver satisfaction. The benefits to nursing include facilitating comparisons of current data to previous events, supporting ongoing record of the client's education, eliminating the need to repeat collection of baseline demographic data with each encounter, saving nursing time, providing universal data access to all, providing data access and quality for research purposes, facilitating automation of critical care and clinical pathways, and supporting the development of a database that facilitates research. Benefits for healthcare providers for using EHR are improved eligibility for and rates of reimbursement, simultaneous record access by multiple users at one time, previous encounters may be easily accessed, faster chart access, more comprehensive information is available, fewer lost records than with a paper system, improved efficiency of billing inclusive of automated charge capture, better reporting tools, and reduced liability through better decision making and documentation. In addition, healthcare providers can benefit by enhanced compliance through system-generated prompts with preventative care protocols, enhanced ability to meet regulatory requirements such as the Physician Quality Reporting System, or PQRS, supporting pay for performance bonuses, notifying early warning signs for changes in a patient's status, supporting benchmarks for how well physicians manage patients with chronic disease conditions, improving population health, and increasing efficiency and workflow. The healthcare enterprise also benefits from using EHR by improved client record security, instant notification of authorization for procedures with integration with payer-based health records, strengthening communications, fewer lost records than with paper charts, decreased need for X-ray film and physical filing, storage, and transport of films, improved cost evaluation based on clinical outcomes and resource utilization data, decreased length of stay, and enhanced compliance with regulatory requirements. Consumers also benefit from the use of the electronic health record by decreased wait time for treatments, improved access and control over their own health information, increased use of best practices by providers with incorporation of decision support, improved ability to ask informed questions, greater responsibility for one's own care, increased medication safety, and increased patient satisfaction. In addition, consumers benefit by getting alerts and reminders for upcoming appointments and scheduled tests, the increased use of preventative care, greater clarity of their discharge instructions, and improved understanding of their treatment choices. Insurance payers also benefit from using EHR by supporting pay for performance as quality measures are gathered, and supporting disease management, lowering costs for expensive diagnoses. According to American Health Information Management Association Journal, since 2009, hospital adoption of EHR has doubled, increasing from 65 to 35%. A total of 85% of hospitals said they intend to attest to meaningful use program this year. Overall benefits of the EHR is that it is accessible from remote sites for many people at the same time while keeping data storage small. Information retrieval can be almost instantaneous. The EHR can provide clinical alerts, expert systems, and reminders. It decreases documentation errors and improves secure, immediate patient-centered information for clinicians involved in the patient's care. Prompts ensure correct documentation and administration of medications and ordered treatments. Prompts also remind staff to chart any pertinent information. Additionally, integration of other health systems means the EHR can draw information from EMRs around the country. Clients use the electronic patient health record to securely access portions of information from the EHR to better communicate with their clinicians. Continuity of care will be assured by using the continuity of care document concept. CCD ensures that when clients move between points of care, a summary of the care provided will be available to the next provider. The EHR also has many benefits for billing and coding. It provides efficient billing since billing codes can be easily accessed. The EHR also provides for more accurate capture of financial charges and billing efficiency. Equipment charges built into the system enable automatic charging for medications that are dispensed, for equipment that is used, and for daily room and service charges. Quick turnaround time of claims and ease of payment tracking is also a benefit. The EHR will also help improve reimbursement rates with CMS, which sets clinical quality measures and helps meet standards set by Joint Commission and National Quality Forum and other quality regulatory agencies. Staff must understand why reimbursement is so important, as eligible healthcare providers may qualify for incentive programs. Now let's discuss meaningful use. In July 2010, the CMS published a final rule which established 3 phases of the EHR incentive program. It's designed to support eligible professionals and hospitals with implementing and using EHRs in a meaningful way to ensure quality and safety of the nation's healthcare system. Stage 1 began in 2011, with stages 2 and 3 to be established by future rules. As hospitals and care providers begin to implement the EHR, they must consider meaningful use. Meaningful use means that certified EHR technology is used in ways that can be measured significantly in quality and quantity. Clients' health and the performance of their healthcare system can be improved by using these 5 goals. Improve the quality, safety, and efficiency of care while reducing disparities, engage patients and families in their care, promote public and population health, improve overall care coordination, and promote the privacy and security of patient information. The first step in realizing meaningful use is planning. Determine what needs and wants the organization has and how these are reflected in its goals. Budget allocation is also a consideration. Implementation will require dedication, preparation, and early planning. Strategic planning is paramount and driven by the organization's mission, vision, long-term goals, services to be offered, population to be served, and the resources that will be required. In order to prepare the planning stage, you must first assess present technology, analyze the data, plan a course of action, identify solutions, and form committees. In the planning stage, you must first identify the organization's mission and scope, vision statement, and goals and objectives. Developing strategies for success by conducting reviews of the organization's strengths, weaknesses, opportunities, and threats is also very important. We will now discuss the planning stages in more detail. The first step is realizing that there is a need. You must conduct surveys and select planning teams to implement the changes that are forthcoming. The second step is to identify the goals and the scope of the project. Thirdly, you must scan the internal and external environment. Define the current situation and identify areas of need. Externally includes vendors, payers, competitors who are outside of the healthcare institution. Any published literature regarding the situation, organizations such as HIMSS, regulatory and accreditation requirements. The internal environment contains employees, physicians, board of director members, interviews, and questionnaires from managers and end users. Once data has been collected, project teams must perform analysis, identify trends, as well as future needs and expectations for the project, determining feasibility of a technical standpoint, and the financial time and resources that will be required. Identifying potential solutions is the fourth step in the process. This may include system upgrades or replacements if the systems that are currently in use are inefficient. The project team should be considering the information system needs of the end users. The fifth and final step of meaningful use planning is the selection of a course of action. Analyze and compare all potential solutions by all project teams. Develop a request for proposal that incorporates a detailed list of end-user requirements. The vendor should then reply and identify their availability and ability to meet specific end-user requirements and the timeline specified. The next step in meaningful use is implementation. Identify a working committee. This committee may include representatives from different departments within the hospital or organization. Their initial task is to develop a timeline for the project, budget, and execution of the plan. They should prioritize the order in which they will go live on each unit. They would also develop procedures and a plan for educating the staff, and provide an ongoing evaluation of how the implementation process is going. Some final questions to consider about meaningful use in the EHR. Are there different information systems currently being used in your facility? Do we choose one system over another as a means to build a cohesive system? Can the system support expansion for the future with features, increased number of users, and patient records? Does the database incorporate nomenclature of medicine, identifiers, codes, and other standard terminology? Other factors that might influence our decision include costs, use of software and hardware, site licenses, consulting fees, training for the system, contract negotiation, and availability of support staff to roll out the system across the units. As we conclude this presentation, the detailed steps and benefits that we have discussed provide an informative look into the consensus for the electronic health record. The use of the EHR and meaningful use technology is most beneficial to all those involved in the healthcare system. We thank you for your time today, and for references, please see the following slide. And we hope you've enjoyed this presentation.